Okay, today we're looking at our patient Janice Jordan. She's a female born 11/17/1947. She is allergic to latex. Looking down at her orders, it looks like we have an order to get a sterile urine specimen from her indwelling urinary catheter today. So that's what we're going to be doing. I'm going to go ahead and grab all of my supplies for pericare as well as for collecting the specimen. And let's go see our patient. Knock, knock.
Come in.
Hi, my name is Ella. I'm going to be your student nurse today. How are you feeling?
You're fine.
You're feeling okay? Good to hear. I'm going to go ahead and provide you some privacy before we get started. And can I have you confirm your full name and date of birth on your armband here?
Sure. Janice Jordan, 11/17/1947. Sorry.
Okay. 11/17/1947?
Yeah.
Okay, that's what I have on your armband here. It also says that you have an allergy to latex. Is that correct?
Yes.
Okay, I will go ahead and use all latex-free supplies today, as well as latex-free gloves on the wall here. Do you have any other allergies I should know about, like food or meds?
No.
Maybe betadine or iodine?
No.
Environmental allergies?
Nope.
Or pets?
Nope.
Nothing like that? Wonderful. Okay, well, or any adhesives?
Nope.
All right, wonderful. Okay, just covering all our bases there. Well, today we're going to be collecting a sterile urine specimen from your catheter here. So what I'm going to do is I'm going to go ahead and make sure that your bed is locked, and I'm going to raise you up just to an appropriate level here. Do you mind if I steal this bedside table from you?
No, go ahead.
Okay, and then so to collect this sterile urine specimen, what we're going to do is we're going to uncover where the port is to collect that sterile urine specimen. I'm going to use my syringe, and I'm going to go ahead and pull the urine directly from the catheter, so you won't have to do anything. I shouldn't have to expose you during this procedure. I'll have to just expose where that the port is, and then we should be good to go, okay?
Okay.
All right, and then afterward, we are going to do some pericare as well, okay?
Okay.
All right, do you mind if I go ahead and lift your blanket down?
No, go ahead.
Okay. I'm just going to expose where the port is here. I'm going to go ahead and put on some gloves here. So I'll hand hygiene, put on some gloves. And like I said before, these are latex-free gloves just for you, Janice. Okay, I'm going to use my clamps. We call them hemostats, and I'm just going to clamp right below the tubing, or right below the port here.
Okay.
Okay, we got that clamped there. Okay, I'm going to use an alcohol swab here. Okay, have you had any issues with your catheter at all?
Nope.
Have you experienced any pain or anything like that?
Nope.
Okay. Are you still having some issues with retention? Are you still feeling like you're not being able to get everything out, or has that been relieved?
No, everything is fine.
Okay, wonderful. I'm gonna go ahead and take my sterile syringe. Right now it is unopened and fully packaged. I'm gonna go ahead and open this up. Okay, I'm gonna go ahead and connect it here to this port. But before I do that, I'm just going to make sure that my cup is open. Okay, and I'm gonna go ahead and collect urine. As much as this catheter will let me. After clamping it, I was able to leave it for 15 to 30 minutes for the urine to collect. And it looks like we were able to get a specimen. Looks like we have just over 3 mLs in here. So I'm gonna go ahead and put it in here, making sure that we're not contaminating the tip of the syringe. And then we'll go ahead and dispose of that syringe. Okay. All right, now that I have done that, I'm going to use my Sharpie, and I'm going to label the specimen. So I'm gonna do the name and date of birth of the client. So Janice Jordan, her birthday is 11/17/1947. The current date is 11/17/2025. Happy birthday, Janice. I'm also gonna put the date and time, or the date and time that it was collected. Looks like it is 5:59 p.m. or 17:59, as well as my initials on here as well to verify who collected it, and then we'll go ahead and send that off to the lab. Okay, I'm gonna go ahead and remove those hemostats for you, okay?
Okay.
Okay. After I do that, I'm just gonna make sure that tubing isn't kinked. I'm gonna make sure that that's still secured to your thigh, and it looks like it is. Are you still feeling okay?
Yeah.
Okay, and now I'm going to perform some perineal care on you, okay?
Okay.
Okay. I'm gonna go ahead and perform hand hygiene, and I'll reapply my latex-free gloves here. Okay, so just like with my perineal care, I'm gonna start with my wet soapy washcloth. Do you mind if I go ahead and expose you?
No, go ahead.
Okay. And it looks like you are still got some chucks on there, so we can go ahead and leave those be. I'm gonna go ahead and work around the catheter, and we're gonna use my wet soapy washcloth just to clean around. I'm gonna anchor that catheter while I do cath care. And then do the other side, anchoring it once again. Okay, and that was my wet soapy washcloth. I'm then gonna go into rinse with my other washcloth. Right. Once again, when I do cath care, I'm going to clamp to make sure we don't have any movement. Are you feeling any discomfort, Janice?
No, everything is fine.
Awesome. Okay, and then we're just going to pat dry from top to bottom. Okay. Go ahead and pat that catheter dry as well. Okay, you still feeling okay?
Yep.
Okay. All right, I'm gonna go ahead and cover you back up, okay, Janice?
Okay.
Okay, and do you want to sit up a little bit more, or is where you're sitting fine?
No, I'm fine. Thank you.
All right, I'm just gonna lower your bed down to the lowest position. I'm gonna make sure that my bed is locked. I'm gonna make sure that the catheter is in the lowest position there at the foot of the bed. I'm gonna assess my surroundings for safety, make sure I have all of my supplies picked up. I'm gonna hand hygiene before I leave the room. Here is your call light, Janice.
Thank you.
All right, and there are those personal belongings back for you. Okay, and I'm gonna go ahead and just hand hygiene, and we'll send this urine specimen off to the lab, okay?
Okay, thank you.
All right, bye.